Good morning, everyone. It's wonderful to see everybody here. Great to have such a good turnout for the day. I see lots of familiar faces and some new faces as well, so I'd like to thank you all for coming today. My task this morning, as Sharon has said, is to talk a little bit about health equity. What is health equity? I've chosen these two photos on the slide for a reason. For me, these two slides demonstrate the importance of the environment in health. They demonstrate the importance of neighborhood and of housing in health. It is not difficult to imagine that the health outcomes for the individuals or families living in these two houses or in these two neighborhoods would be quite different. There are a number of terms we use when we're talking about health inequity, and sometimes we use these terms interchangeably, but they are not necessarily interchangeable. The term health disparities really refers to differences in health status across the population. So some people are healthier than others. There are disparities in health across the population, or differences in health across all populations, including our population here in Nova Scotia. The term health inequalities is similar to health disparities or health differences. It's really an epidemiological observation about where good health or where poor health lies across a population. When we're talking about health disparities or health inequalities, we're really talking about the what. What does our population look like? What diseases or injuries are more prevalent in which parts of the population? But when we talk about health inequities, we're really asking a why question. We are asking a question about why some people are healthier than others and what we might do about that. The World Health Organization in 2009 established a Commission on Social Determinants of Health, and their report is called Closing the Gap in a Generation. According to the World Health Organization, where inequalities in health are avoidable, yet are not avoided, they are inequitable. So health inequity results when avoidable inequalities in health are not avoided. And health equity results when avoidable inequalities in health are, in fact, avoided. And how, you might ask, do we avoid inequities in health? And the primary drivers for avoiding inequities in health are really around macro policy, public policy, social policy, economic policy, agricultural policy, etc., that impact the conditions in which people grow, live, work, play, and age. And those conditions impact what kind of health status people will have within their families and communities. So the question is really, why are some people healthier than others? Which populations are less or more healthy than others? And how do we create equitable conditions for health in our province and in our societies? Inequities in health arise out of inequities in life conditions. For example, early childhood or social exclusion can lead to poor health. There is a wealth-health gradient across the population that runs across the entire income spectrum, such that it's not just the wealthy who are healthier and the poor who are less healthy. That gradient runs across the entire population such that even folks in who have middle income or live in middle income categories are less healthy than people who are wealthy, and they are more healthy than people who are poor. So there is a gradient, and it runs across the entire population, and we are all affected by that wealth-health gradient. Ultimately, health reflects social status. Health reflects where we sit on a number of social hierarchies. Where people are on these social hierarchies affects the conditions in which they grow, live, work, play, and age. Their vulnerability to ill health, whether or not they will get ill or be injured, and the consequences of ill health, what kind of treatment they might seek out, what kind of treatment they might receive, what are their chances for recovery. All of those aspects of health are affected by the conditions and the environments in which people live. So why should we be concerned about health equity? Because ultimately, it affects all of us. Inequity through poverty, exclusion, discrimination has more impact on health than the choices people make in their daily lives. If you look at your package that you received when you registered, there is a one-page handout, a double-sided handout there about health equity, which you may refer to throughout the day. On that handout, on the second page, there is a graphic of the trajectory of health disparities or health inequities that looks at the underlying causes of health inequities. And that graphic shows that most of the causes for health inequity and poor health are really to be found in the environmental domain, not within the choices people make and not within healthcare systems, although those are in fact important as well. But primarily, we need to focus on the environments for health. One of the tools that we've been using for the last couple of years through the diversity committees and in the Department of Health and Wellness is a film series called Unnatural Causes: Is Inequality Making Us Sick? The short answer to that question is yes. We have used this film series, we showed it over a period of 9 months at the Art Gallery of Nova Scotia with great audiences, and the film series was really able to help us increase our understanding of health equity and health inequity, and to spark discussion about how we address some of the health inequities that we are faced with in our population. Some of the key themes from Unnatural Causes included the fact that health disparities or inequalities are not natural. They are not inevitable. They are human-made. They are built into our systems, our education systems, our economic systems, our justice systems, our cultural systems. We as human beings have created conditions of inequity. The choices people make are shaped by the choices that they have. The isms are an added burden for health. The film series on natural causes really focuses on racism as an added burden for health. But in addition, sexism, heterosexism, classism, ableism, all of these isms impact people's value as citizens and people's health. The cumulative stresses associated with daily life have negative effects on physical and mental health. Stress is bad for your health. Living in difficult or disadvantaged circumstances is bad for your health. One reason for that is because of the stresses associated with that. And cumulative or chronic stress wears down the body systems. We have many scientific studies showing the increase in cortisol levels related to high levels of stress, and that in fact leads to cardiovascular and other illness. Where people live is a good predictor of their health. Your postal code is a good predictor of your health. And finally, social policy is health policy. As I've said, economic policy is health policy, agricultural policy, housing policy, transportation policy. These are all health policies on which we must focus in order to create more equitable conditions for health. So one of the tools that is contained on the Unnatural Causes website, and I would encourage all of you to go to the Unnatural Causes website, unnaturalcauses.org. It's an amazing film series, and the website is chock-a-block full of resources that all of us can use in our work. One of the resources they have there is a health equity quiz. So we've drawn from that idea of a health equity quiz, which for Unnatural Causes is situated in the US, and we have created a Nova Scotia health equity quiz for your enjoyment today, and your learning enjoyment as well.